my name is Miss Mentor, and I'm doing this video for Nursing 1200. It's for your first skill. The Bridge program can also use this video, but the Bridge students are not here as often, so the way you do practice and the way you do checkoff could differ. When I get ready to do the video, I may work through the skill and then explain what I'm doing, or I may explain what I'm doing while I'm working through the skill. I'm going to go ahead and get started. Knock on the door, provide privacy. All right, my name is Gina. I'm going to be your nurse today. Can you tell me your name and date of birth? Do you have any allergies? All right, the doctor's ordered you some fluids and some pain medicine. It's going to help hydrate you. With the pain medicine, hopefully that takes care of your pain. What did you say your pain score was? Okay. Just if you need to get up, please use your call bell and let me know. All right. And just so you guys know, there's two parts to this skill. It's IV fluids and IV push medications. For the IV fluids, all you have to do is spike and prime a bag correctly. Now I'm going to show you how to set fluids if you don't have electricity, and how to set a drip factor. And I'm also going to work you through the pump, but just know that for your checkoff, all you're going to have to do is prime and spike and prime your bag correctly. And I'm going to leave it up to you. You know, in practice you would definitely wear gloves, but I'm not going to wear gloves through this whole scenario. Okay, there's a video that comes with the book, the Elsevier video. You'll notice that she hung the bag up and then she spiked it with it already hanging up. For when you're in the lab and when you're in the simulation lab upstairs, we want you to hold it here and spike it like I just did. So it's going to help with air bubbles if you do it that way. Also, if you hang it up here and you try to spike it, you could not spike it correctly and fluid just comes pouring out. Also, when you get ready to spike it, be careful. You don't want to go through the tube and get your finger. And you'll notice I pulled this off. When you go to spike it, you want to stay sterile. You can touch just what this was covering, but you don't want to let the spike touch up here. You would contaminate it. If it was a checkoff, you would need to let me know that you contaminated and that you would have to get a new line. And in the video that came with the book, she didn't start with this being clamped here. If you don't do that and you spike it, fluid's just going to start running out without you being able to set your drip chamber. And that's another way to get air bubbles. Some of your drip chambers will have a line here that shows that you need to set it about 50% of the way, but just know you need to set that about halfway. If the electricity was down, you would need to run this by gravity without a pump. So Ms. Maddox should be working with you with clinical calculations and showing you how to work those problems. So here, the order says to run this bag over 4 hours, 1,000 milliliters over 4 hours. And the way Ms. Maddox does it, on your Elsevier video, it actually shows a different way. But I'm showing you here how Ms. Maddox does it. Your starting factor for your dimensional analysis is 1 minute. Your answering unit is drops. So you start off with your starting factor. The order is 1,000 milliliters over 4 hours. And I'm using 10 drops per milliliter tubing. You can use 15 milliliters per milliliter, and this would change what goes right here. If I'm doing this over 4 hours, it's going in at about 250 milliliters per hour. Anything over 100 milliliters per hour, you're going to use a 10 or 15. If I was to put this in under 100 milliliters per hour, I would use 60 drops per milliliter tubing. So if I work this problem, I have 1,000 times 10, 60 times 4, that gives me 1,000 over 24. It gives me 41.6 drops per minute. When I'm using a drop factor, you want a whole number. So we're going to say 42 drops per minute. I want to know how much to put in over 15 seconds so I can set this a little easier. You just divide by 4. That tells me how many drops in 15 seconds, and hopefully I'll come up with 42 drops per minute. So you'll notice when I prime this, I didn't have to take this off. Sometimes you may have to loosen it, sometimes you may have to take it off. If you have to take it off, try to keep it sterile. So I'm watching the clock, slowing it down a little bit. I want to get about 10.5 drops per 15 seconds, and that should give me my 42 drops per minute. So just a tad faster. And then, so once you get that at 15 seconds going the way you need it to go, do it for a full minute and see if you get the 42 drops per second. So that's something I want you to practice during the mandatory practice, but it's not part of your checkoff. So now I'm going to show you some things about the pump. This is already going to be loaded for you. Well, it'll be set up here. I want you to play with it. So I want you to load the line. The manufacturer suggests that you start from the top and go down. Blue to blue. It's white on this end. It's blue on this end. It's blue here. Start from the top. Push the blue piece in and right here, and then you close it. And you have to use a little pressure. And you've got it loaded. So turn your pump on. If it's the first time using this pump on this patient, you need to add a medical record number. It's going to ask you. It's going to say, is it a new patient? If it's the first time, you say yes. If it's the second time, you're going to say no. I'm going to say yes. And then it's asking for the medical record number. It's on her armband. It's also on the order. And it has here confirm. I'm going to hit confirm. Then it's going to ask if this is an adult patient, and I would say yes. It has channel A and channel B here. Obviously there's nothing loaded under channel B. So I'm going to work with channel A. It has it here, but you don't press here. You hit channel select. So channel select. You have guardrail drugs, guardrail fluids, and basic infusion. You don't want to work under basic infusion for the most part. You can set any rate and any volume you want to. Here's your silence button. Guardrail drugs and guardrail IV fluids are there to protect you. So pharmacy has a drug library loaded into this pump, and if you do, it's going to recommend a certain rate and a certain volume, or if you go too high, you're going to get these red flags. You can bypass it and do it anyhow. Just know that pharmacy gets a report on everything you do with this pump. So the guardrails keep you safe. If you just want to set whatever, you can under basic infusion, but see if your drug is loaded in there. See if your fluids are loaded in there. And then if you have to go under basic infusion, you probably want to let pharmacy know. It may be a new drug that they need to add to the drug library and add to all their pumps. So we need to go back again, channel select. I have guardrails, IV fluids. These are IV fluids. I'm going to hit that one. And so it has half normal saline with potassium, normal saline. This is normal saline. I can page down, there's more, there's blood, but I'm going to go back up and hit normal saline here. It says, is that what you want to do? Yes, that's what I want to do. And then it lets me set my rate, my volume. So the order is for a continuous infusion at 75 cc's or milliliters an hour. So I'm going to hit my rate. You would think you just press in the number, but you have to hit this button that says rate. Then you can press in 75 and then volume to be infused. Some people will set the volume at like 995 just so that your line doesn't run dry, because when this finishes, it's a continuous infusion. You just hang another bag. You can use that same line. Or you could set it at 1,000, that's fine too. And you're almost done, you just hit start. It should start beeping at me because this is clamped. And there it goes, it says it's occluded. So I forgot to unclamp it. I'm gonna unclamp it, but now you have to hit restart. It's actually gonna beep at me again because there's a cap on this. I need to flush the IV and connect this, and then it's gonna run like it's supposed to, but we're gonna come back to that. You can hit pause if you need to, and again restart. I'm gonna channel off, press and hold to turn the pump off. It says powering down. I want to go over a secondary infusion. Again, this is not mandatory for the checkoff, but it's something that I want you to practice while you're here. I need to grab a secondary tubing for this. I want my secondary to go in right now. So I need to hang my primary lower. Like this, or you can bring this up here. It'll still be lower than the secondary bag. And I'm going to clamp it. What's underneath here is sterile, so don't let it touch anything. And then try to go straight in. Again, be careful not to go through and get your finger. your drip chamber. Now you need to prime it. And when you're priming these bags in checkoff, you need to have less than 10 cc's of waste. And the secondary line is going to be harder. We'll see if it'll do it with the cap on. I'm done. See, I didn't have anywhere close to 10 cc's of waste. It's primed. All right, so your secondary line is shorter, and it's going to go to this port right here above the chamber. It needs to be wiped with alcohol. 30 seconds. And just so you know, if it had one of these caps on there, you would have not had to do that. These are impregnated with alcohol, and if they're on here, you can just take this off. They're one-time use, and either push medications or add your secondary line. Oh, that's not what I needed to do. Just so you know, this should not be hanging there without a cap on it. I'm not sure what happened to it. This should have a cap on it. And all these other extra ports, not all facilities have enough, or they don't use them. But if they have these caps that can go onto these extra ports, use them, especially if you have a PICC line or a central line, because PICC lines and central line increases your risk for infection. So you want to keep these caps covered, or covered with your caps. All right, again, we're going to come back to this. Actually, I'm going to go ahead and show you the secondary line setup. So again, you turn it on. It's not going to be a new patient this time, so when it says yes or no, new patient, I'm going to say no. Sometimes it will say, is this an adult patient? And you say yes. It's not asking me that right now. I am using channel A. You remember it's Guardrail IV fluids. I'm using normal saline at 75. Is this correct? Yes. What's my rate? 75. Volume 995. Now it's asking me, you have an option here for secondary, and that's where I set the secondary bag. So I can hit secondary, and it's asking me the rate. We're just going to say we're going to give vancomycin 500 milligrams, 100 milliliter bag. Rate, we'll say 100, volume 100. That's going to go in over an hour. I can hit start. Make sure your secondary is dripping. I'm going to press and hold channel off. All right, if the patient didn't have fluids ordered, you could use a primary line, a longer line that connected to the patient, and just this little bag, and use Guardrail drugs and set your primary line. And once you're done with that drug, that bag, you just disconnect, and she's not connected to anything. Okay. And I'm just going to pretend like that's the situation, that we have a primary line connected to a drug, vancomycin. Here in the lab, if you hit secondary, it's not going to ask you which drug. It's going to let you put in whatever rate and volume. These are very popular pumps. They use them at a lot of facilities. When you hit secondary there, it's going to ask you which drug it is. So I'm going to set it as a primary so that we can go under drugs. New patient, no. Channel A, guardrail drugs. So I'm going to look for vancomycin. Here's U through Z. Here's vancomycin. So I'm going to do non-weight based, and I have two options. This is your guardrails: 500 milligrams in 100 milliliters or 1,000 milligrams in 200 milliliters. I've got the 100 milliliter bag. It says 500 milligrams in 100 milliliters. Is this correct? Yes. Is this how I want to run it? Next. And if I'm going to go do it over an hour, it's 100 milliliters, the bag's 100. Volume to be infused, 100, and start. If this was a primary bag, that's how I would set my guardrail drugs. Okay. Now I'm going to move to your IV push medications. We're going to say that the doctor has ordered 3 milligrams of morphine. Have to find my drug. Dexamethasone, this is morphine. There's 4 milligrams in 1 milliliter. There's 10 milliliters of fluid. If you gave this whole vial, it would be 40 milligrams. The doctor's ordered 3 milligrams. To work that problem, again, we did that with the shots, pulled medications out of a vial. But if you do it using dimensional analysis, like Ms. Maddox teaches, you have your starting vector, 3 milligrams. You have 4 milligrams in each milliliter. So that gives you 3 over 4. That gives you 0.75 milliliters of fluid. When I look morphine up in the drug book, 3 milligrams is an appropriate dose. I need to look to see if it needs to be diluted or not, and if it needs to be given over a certain amount of time. Any IV pushes you want to give kind of slow and steady. But there's certain drugs that you give over a very specific amount of time, and morphine is one of those. You'll find that you have to give it over 4 to 5 minutes. I'm going to choose to give it over 4 minutes. And it also calls for a diluent, so 5 milliliters of normal saline. So I'm going to pull up my 5 milliliters of normal saline. Actually, I'm going to pull up 5.25 milliliters of normal saline. Can you think of why I might have to do that? Because you can, and it makes it easier to work with. So 6 is easier to work with than a total volume of 5.75. So this is my normal saline. I'm going to use as a diluent. You know what, this needle worked fine for my smaller vial, but if you need to get into a bigger vial and you've got a large amount of fluid, you can use a blunt fill needle. It's just a smaller gauge. I'd prefer you not to use these blunt fill needles with these smaller vials because we'll be reusing them, and if you use these large needles with the smaller vials, they're hard to reuse. They make big holes in them. All right, I'm going to pull back a little bit on this and add my medication. Just to keep this covered, do that. So now I have 6 cc's of fluid, and I have to push it over 4 minutes. All right. So if I divide that by 4, that's 1.5 milliliters per minute, or you could think of it as 0.75 milliliters over 30 seconds, or 0.375 milliliters over 15 seconds. So you guys will have an IV fluid checkoff sheet, an IV push medication checkoff sheet, and a worksheet. And on your worksheet, you'll have practice problems. And on your practice problem, you're going to have to find out if there's a diluent required for that drug, if there's a certain time frame, and how much to push over 15 seconds. And you need to do that worksheet before you come to class. So I know that I need to push about 3.7, 3.8 every 15 seconds. So I'm going to watch the clock as I do that. I'll need to flush the IV. And you'll notice on your checkoff sheet that it says to push the first milliliter the same rate you're pushing your drug. You never know what's in your line or if the last person flushed their line. And after you give the medication, you want to push the flush at the same rate, at least the first cc, so that you're not slamming the medication in. That defeats the purpose of pushing the medication over 4 to 5 minutes, because you have, an extension here, and you're going to have medication sitting in that line. If you just flush it in, then you've defeated your purpose of pushing it slow. So I'm going to wipe this for 30 seconds. This is my flush. If you were to get these medications ready outside of the room, you would need to label them. If you're inside the room, you don't have to label them, but you do need to keep them straight. I've got a little bit more than 10 cc's here, and I don't like that. So I'm just going to go up to the 10 for my flush. So 2 to 3 cc's will flush this line, but that first cc we want you to push slow. Try to push it the same rate you would push your drug. And then in another 15 seconds. So for the first milliliter, I'm pushing it at the same rate. It's been 15 seconds. All right, so I've pushed in a cc, and I want to flush at least 2 or 3 cc's before I get started with my medication, so I can slow and steadily push in my next 2 cc's of flush. That's 1 cc, 2 cc. As long as your IV is not touching anything, you can leave it there. If it flops down and touches the bed, clean it again. Wait till I get to a good starting point, and then I'm pushing every 15 seconds. I'm going about 0.38, and then it's another 15 seconds, 0.38, until I get the whole medication in. It should be 4 minutes. All right, I'm going to stop here because I'm not going to waste 5 minutes of doing this, but you would actually, for the whole 4 minutes, push the medication like you're supposed to. And then you flush, again, the first cc, the same rate you push this, and then you can push in another, 1 or 2 cc's. Some people will flush with 5 cc's, but 2 or 3 cc's will flush that line. Okay, so for your checkoff, you have boxes with lines in them. You have one of these lines. You're going to practice with multiple lines. But for your checkoff, you're going to use one of these lines and prime this bag of fluid. Then you're going to go draw up your medication, bring it over here. Now you can do what I just did and give it through the IV here, or you can have this pump. You can go ahead and turn on your pump. And if you do that, if you connect, I'm sorry, I'm right-handed. If you connect here, then you can give your medication. If you have normal saline, you can turn on your pump, set it to 75 cc's an hour. You can push your medication through here just like you pushed it through here, and I'll give you that option. So you'll prime your bag, put it in the pump, go draw up your meds correctly, give it through here, or set your line and give it through here. Turn on your pump. Remember, turning on the pump, it takes a while to work through the pump, and pumps are different. So that's not part of the checkup, but I want you to practice it, and you're done. Don't forget your line. A lot of people forget their line. If this is a primary bag, if it's continuing, it's going to the patient, and there's never a break in that line, then it's 72 hours, 4 days. So I would grab a Monday tag, date and initial it, and put it on my primary bag. Now, if I was tagging a secondary line and there was never a break in the line, I didn't disconnect it and let it hang here with a cap on so that I could use a different antibiotic, it would be 72 hours as well. But if it's hanging here like this and it's not continuously flowing, it's 24 hours. So you would need to get, if today's Thursday, you would need to get a Friday tag. All right, so I hope that was helpful. There is a lot with this skill, so you may need to come in and do not only your mandatory practice, but your optional practice as well. Last semester I did a demonstration each time. This time I hope by watching this video before you come to your mandatory practice, I hope it saves time. Let me know if it helps. Thank you. That's all.